back to my channel Mis.Medicine. Today we will discuss about lung diseases and their classification according to the location or affected parts. So first part is lung diseases which affect the airways. Diseases like asthma or COPD. Second one is lung diseases which affect air sacs like emphysema, pneumonia. Third one is lung diseases according to interstitium like sarcoidosis. Fourth one is according to blood vessels like pulmonary embolism. Fifth one is lung diseases which affect pleura like pleural-effusion, hemothorax, chylothorax, etc. Sixth one is lung diseases according to or which affect chest wall like obesity, hypoventilation syndrome. I would like to repeat again. Lung diseases which affect airways like asthma, COPD, chronic bronchitis. Second one, lung diseases which affect air sacs like pneumonia, tuberculosis, emphysema, etc. Next one is lung diseases which affect interstitium like sarcoidosis, autoimmune diseases, pulmonary edema. Fourth one is lung diseases which affect blood vessels like pulmonary embolism, hypertension. Fifth one is lung diseases which affect the pleura like pleural effusion, hemothorax. And sixth one is lung diseases which affect the chest wall. First one is lung diseases which affect airways. Diseases like asthma, like COPD, chronic obstructive pulmonary disease. Third one is acute and chronic bronchitis. Fourth one is emphysema. And fifth one is cystic fibrosis. So, what is asthma? Asthma, it is a chronic disease of the airways that makes breathing difficult. With asthma, there is inflammation of the air passages that results in a temporary narrowing of the airways that carry oxygen to the lungs. This results in asthma symptoms which include coughing, wheezing, shortness of breath or dyspnea, and chest tightness. Second one is COPD. Chronic obstructive pulmonary disease is a common lung disease. Having COPD makes it hard to breathe. There are two main components of COPD. Chronic bronchitis, which involves a long-term cough with mucus. Emphysema, which involves damage to the lungs over time. Chronic bronchitis, have mucus with cough. Third disease is acute and chronic bronchitis. Chronic bronchitis is one type of COPD. The inflamed bronchial tubes produce a lot of mucus. This leads to the coughing and difficult breathing. Cigarette smoking is the most common cause. Breathing in air pollution, fumes or dust over a long period of time can cause acute and chronic bronchitis. What is acute bronchitis? It's also known as a chest cold. It's a short-term inflammation of the bronchi, large and medium-sized airways of the lungs. The most common symptom is cough. Other symptoms like coughing up with mucus, wheezing, shortness of breath, fever, chest discomfort, etc. Infection, acute bronchitis. This infection may last up to 10 days. Fourth one is emphysema. What is emphysema? Emphysema is a lung condition that causes shortness of breath. In the people with emphysema, the air sacs in the lungs alveoli are damaged. The inner walls of the air sacs weaken and rupture, creating larger air spaces instead of small ones. Next and last one is the cystic fibrosis. What is cystic fibrosis? It is a genetic disorder that affects most of the lungs, but also the pancreas, liver, kidneys and intestines. Long-term issues include difficulty in breathing and coughing up with mucus as a result of the frequent lung infections. Asthma, COPD, acute and chronic bronchitis, emphysema and cystic fibrosis affected the airways. Okay. Next classification is lung diseases which affect the air sacs. Asthma, COPD, acute and chronic bronchitis, emphysema and cystic fibrosis affected the airways. Okay. Next classification is lung diseases which affect the air sacs. Air sacs. Diseases like pneumonia, tuberculosis, emphysema, pulmonary edema, lung cancer, acute respiratory distress syndrome, acute respiratory distress syndrome, ARDS, and last one is pneumoconiosis. Pneumoconiosis like black lung disease, silicosis, asbestosis, dust eczema, etc. First disease is pneumonia. What is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material which cause cough with pus, fever, chills or difficulty in breathing. It can be caused by bacteria, viruses and fungi. Next one is tuberculosis. Tuberculosis is a disease which caused by Mycobacterium tuberculosis. The bacterium usually attacks the lungs, but they can also damage other parts of the body. Tuberculosis spreads through the air when a person with tuberculosis of the lungs or through throat coughs, sneezing or talks. Next disease is pulmonary edema. Next disease is pulmonary edema. What is pulmonary edema? It is a condition caused by excess fluid in the lungs. This fluid collects in the numerous air sacs in the lungs, making it difficult to breathe. Next one is lung cancer. Lung cancer, also known as lung carcinoma. It is a malignant tumor characterized by uncontrolled cell growth in the tissues of the lung. Most cancers that start in the lung, known as primary lung cancers or carcinomas. The two main types of carcinomas are small cell lung carcinoma and non-small cell lung carcinoma. Small cell lung carcinoma and non-small cells lung carcinoma. Fifth disease is ARDS. ARDS is acute respiratory distress syndrome. It is a type of respiratory failure which is characterized by the rapid onset of widespread inflammation in the lungs. Symptoms are like shortness of breath, rapid breathing, and blue skin. Next disease is pneumoconiosis. Pneumoconiosis is an occupational lung disease and a restrictive lung disease caused by the inhalation of the dust, often in mines or from agriculture. Diseases are like silicosis, asbestosis, black lung disease, and dust eczema. Type is lung diseases which affect the interstitium. Diseases are like sarcoidosis, second one is idiopathic pulmonary fibrosis, third one is autoimmune disorders, and fourth one is pneumonias and pulmonary edema. We already discussed about that. Next disease is sarcoidosis. Sarcoidosis, it is a disease which involves abnormal collection of inflammatory cells that form lumps. Lumps are known as granulomas. The disease usually begins in the lungs, skin or lymph nodes. Less commonly affected are the eyes, liver, heart and brain. Any organ can be affected by the sarcoidosis. Next disease is idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis or IPF, it is a disease in which scarring or fibrosis of the lungs from the unknown reason. Over time the scarring gets worse and it becomes hard to take in deep breath and the lungs cannot take enough oxygen. This is autoimmune diseases. It is a condition in which your immune system mistakenly attacks your own body. Like your joints, skin, it works as foreign material or foreign body comes to your body. It releases protein which called autoantibodies that attack healthy cells. Next is pneumonia and pulmonary edema. We already discussed this. Fourth part is lung diseases which affect blood vessels. Diseases like pulmonary embolism, and pulmonary hypertension. Pulmonary hypertension. What is pulmonary embolism? It is a sudden blockage of major blood vessel or artery in the lung, usually by a blood clot. The clots are small and are not deadly, but they can damage the lungs. But if the clot is large and stops blood flow to the lungs, it can be deadly. Next disease is pulmonary hypertension, PH or PHTN. Pulmonary hypertension. It is a condition of increased blood pressure within the arteries of the lungs. Symptoms are like shortness of breath, syncope, tiredness, chest pain, swelling of the legs and a fast heartbeat, or can be tachycardia. Condition may make it difficult to exercise. Pulmonary hypertension is also known as ARDS syndrome. ARDS syndrome. Next type is, fifth number is lung diseases which affect pleura. It includes pleural effusion, pleural effusion includes pneumonia and heart failure also. Pneumonia and heart failure. Next disease is pneumothorax. Pneumothorax, it is collapsing of lungs. Next is mesothelioma. It occurs after asbestos exposure which form cancer. After asbestos exposure can cause cancer. It is a rare cancer. Next is hemothorax and chylothorax. Hemothorax and chylothorax. In hemothorax and chylothorax, lymphatic fluid present in pleura. Lymphatic fluid. Present in pleura. Pleural effusion, sometimes referred to as water on the lungs, is the buildup of excess fluid between the layers of the pleura outside the lungs. The pleura are thin membranes that line the lungs and the inside of the chest cavity and act to lubricate and facilitate breathing. Next is pneumothorax. What is pneumothorax? Pneumothorax is a collapsed lung. A pneumothorax occurs when air leaks into the space between your lung and the chest wall. This air pushes on the outside of your lung and makes it collapse. Next is mesothelioma. Mesothelioma is a tumor of that tissue. It usually occurs in the lungs but can also start in the abdomen or other organs. It can be benign and malignant. Malignant mesothelioma is a rare but serious type of cancer. Most people who get it have worked on jobs where they inhaled asbestos exposure or asbestos particles. Next is hemothorax. Hemothorax is a collection of blood in the space between the chest wall and the lung, the pleural cavity. Next is chylothorax. Chylothorax is a type of pleural effusion. It results from lymph formed in the digestive system called chyle accumulating in the pleural cavity due to either disruption or obstruction of the thoracic duct. Next classification is lung diseases which affect the chest wall. It includes obesity hypoventilation syndrome, and neuromuscular disorders. Neuromuscular disorders like myasthenia gravis, and ALS, amyotrophic lateral sclerosis. A, L, and S, amyotrophic lateral sclerosis. What is obesity hypoventilation syndrome? Is defined as the combination of obesity, hypoxemia during sleep and hypercapnia during the day, which results from hypoventilation. Hypoventilation means slow breathing. Next is neuromuscular disorders, myasthenia gravis. Myasthenia gravis, it is long-term neuromuscular disease that led to very degree of the skeletal muscle weakness. The most common affected muscles are those of the eyes, face and swallowing. It can result in double vision, dropping eyelids, trouble taking and trouble walking. Next is ALS, amyotrophic lateral sclerosis, also known as motor neuron disease, or Lou Gehrig's disease. Lou Gehrig's disease. It is a specific disease that causes the death of the neurons which control voluntary muscles. Some also use the term motor neuron disease for a group of conditions of which ALS is the most common.